With that, ladies and gentlemen, let us in fact get right into the top focus of this bulletin, which is a story that has now been ringing alarming bells for the people out there, especially among the youth. Yes, this is with regards to Rohan Marchandani, or the Epigamia co-founder, who's recently lost his life to cardiac arrest. Let's take you through this very story, and let's also understand the deeper concerns involved in this very story, which is a rise in cardiac arrests amongst the youth. Why is it so? We'll have two doctors joining us to take us through the details of this very matter. Rohan Marchandani, co-founder of Epigamia, one of India's leading Greek yogurt brands, passed away at the age of 42 following a cardiac arrest. The news of Marchandani's death was confirmed by Drums Food International. All of us at the Epigamia family deeply mourn this loss. Rohan was our mentor, friend and leader. We remain steadfast in our determination to carry forward his dream with strength and vigor. Rohan's vision and values will in fact continue to guide us as we work together to honor the foundation he built and ensure that his dream continues to flourish. This is the statement that in fact was issued by the Drums Food. Marchandani's death has sent shockwaves across the country, and not for the first time. This is in fact yet again on your screens, ladies and gentlemen. We bring to you such eminent personalities, all young ones that we have lost to cardiac arrests. His passing away has in fact again highlighted the growing concern of cardiac-related deaths among young people, an issue which is becoming increasingly common these days. With me today on this bulletin is Dr. Rajeev Jayadevan, author and national co-chairman, IMA COVID Task Force, and Dr. Simi Manocha, director, cardiology, Accord Super Speciality Hospital, Faridabad. Well, I welcome you both to the show. Thank you so much for speaking to us at News 9. Dr. Jayadevan, I would want to come to you first. You know, one of the biggest concerns at this given point is the fact that is the rise in these cardiac arrests related to not just COVID, but also specifically the COVID vaccines, because we've been seeing a spike in such heart-related cases, and especially among the youth, which is extremely alarming at this given point of time.
First, let me explain the difference between cardiac arrest and a heart attack. Many people are confused between the two. Cardiac arrest simply means the heart stops beating. And that can happen for many reasons. For instance, if there's a massive heart attack, it can lead to the heart stopping. If a stroke occurs, the heart can stop. A person drowns, or a person has abnormal blood salt levels, for example, potassium levels, heart can go into an abnormal rhythm and stop. Or if a person has cardiomyopathy, which is basically a muscle disease of the heart, or the person has an arrhythmia, which means a rhythm disturbance. All of these things can result in a cardiac arrest. Whereas a heart attack, for our viewers, it's simply a blockage that occurs in the arteries or the blood vessels that supply the heart. So now the information we have here is simply that this person had a cardiac arrest. We don't have any medical information that is verifiable at this time. So you asked if this is the result of COVID or COVID vaccine. We know that there's a lot of social media outcry about vaccines causing sudden deaths, and that's been debunked by our own study in India. The ICMR has done a very comprehensive study from multiple states in our own country and confirmed that the chance of a vaccine causing sudden death is not there at all. So that's been completely proven to be false. COVID itself is a risk factor for coronary events or heart problems. Yes, that is true, and especially repeated COVID infections. That's an established fact. But for our viewers, let me take you through the 10 established risk factors of heart attacks: age, gender, smoking, heavy use of alcohol, and then high cholesterol level, diabetes, and hypertension, and a family history of young onset heart disease. Now, among these, we can't alter our own family history. We can't alter our age. So what we have left are our smoking, our alcohol, our sedentary lifestyle. I should have mentioned that. Exercise levels, monitor our blood pressure, make sure our sugars are normal if we have high blood sugars, and keep our cholesterol at a reasonable limit. And also make sure that we don't get abdominal obesity, which is basically fat around our middle. It's a belly fat that is more of a risk factor. Now, we don't know whether any of these apply to the case in question here, but this is a general statement. There are things that we can change, and there are some things that we can't change. But I want to point out that vaccines or stress are not established risk factors for cardiac arrest or a heart attack. Many people think that if somebody dies suddenly, it's because of stress. That is false. Stress does not cause a sudden death, but it can aggravate some risk factors. For instance, if a person eats junk food, that stress may prompt this person to eat more junk food. Stress may induce a person to drink more and smoke more, but directly there's no relation. So these are some important pointers for our viewers.
Absolutely, Dr. Jayadevan. In fact, thank you so much for giving us such informed insights into what exactly is cardiac arrest and how is it different from heart attack at this given point. With that, Dr. Manocha, coming to you next. At this point, as Dr. Jayadevan also said, that stress isn't a direct factor that causes cardiac arrests. But we also see in today's day and age, the kind of lifestyle we're all leading. We're all unfortunately in a 9-to-5 job, and we are in most cases restricted to that work area. So half the times our lifestyle is quite sedentary. We do not end up eating very healthy at this very point because of stress, which is work related or otherwise. So there are a lot of lifestyle issues we're seeing crop up amongst today's young generation. And given that India has such a youth-centric population at this given point, what would your advice be to the youth today to take care of themselves?
Yeah, Sriya, thank you for giving me this opportunity. Dr. Rajeev has highlighted the modifiable and non-modifiable factors, as you say, because there are certain things which we can't help, but there are certain things which we can help. COVID was directly responsible for inflammation, and during that epidemic of COVID, we have seen inflammatory changes in the heart, inflammatory changes leading to heart attack during COVID, and definitely a surge in younger population. Though we have been observing this change pattern of younger people getting involved, but now the cases which have been highlighted in social media and the news channels, that young people, they are not even getting an opportunity to be treated. That is sudden heart attack leading to cardiac arrest, and patients even don't get an opportunity to reach the hospital. It tells us that we have to start working on a lifestyle. And if we get any warning symptoms, please do not ignore. So warning symptoms, most of the times people will, pass it off as gastric issue, gastritis and ulcer issue. But younger people especially, they can't even believe that they have cardiac issues. So they don't even approach the doctor, which is really wrong. And plus the changed lifestyle after COVID, like work from home concept, which has started, the companies feel very comfortable that they are saving out on money on offices. But actually our younger generation has, their lifestyle has gone for a total change. They are hardly exercising. Since they are not getting out of the house, so they are, totally sedentary. Since they are sedentary, the warning symptoms don't come to them. Plus, just sitting like a couch potato and eating all the junk food, which is easily available on the Zomato, Swiggy platform, they are also responsible for this. So I think you have to have a preventive health check after the age of 30 years. If everything is normal, repeat it after 2 to 3 years. But if your risk factors are deranged, like you have dyslipidemia, you have diabetes or predisposition to diabetes, or your BP is high, you have to have a regular checkup, get your risk factors under control, be physically active, manage your stress by delegating the responsibility of different tasks to other people also, and take care of your health. If you manage your risk factors well, you can delay or postpone these cardiac symptoms, because you are not actually giving proper opportunity of exercise to your body. Your body is also not giving you or showing you the signs of cardiac events, and ultimately they get passed off as gastric issue, and then you end up having a sudden cardiac arrest due to heart attacks.
Absolutely, definitely. In fact, Dr. Manocha, a short follow-up there. as you mentioned, a lot of people, or rather a lot of young people today, they do not believe that these are warning symptoms of a cardiac arrest. How would you say one can differentiate it? What are the measures they should in fact be taking up? What should they be on the lookout for under such circumstances to understand and address the problem at an early stage?
Warning symptoms for cardiac issue would be that they are losing their stamina. The things they were able to do easily, now they are not able to walk. If a person was able to walk for 2 kilometers, and now after even walking for 100 or 200 meters, they start feeling some congestion in the chest. They start feeling some breathing issues. And then if they have gastric-like symptoms, which previously they were not facing, and suddenly they start having burning in the chest, burning in the epigastrium, and they are feeling low, and then they exercise, they don't have a good feeling. I think that is the time to get the risk factors checked and also get a preventive health check done to know their heart health.
I think these are very important factors that you've pointed out for our viewers out there. Dr. Jayadevan, there is one question I would ask you at this point. While we have spoken about COVID and stress as causing factors, let's also take a look at pollution in today's day and age. Pollution as well as severe weather conditions. We've seen how global warming, El Nino effects having, taken a toll on people. We see pulmonary issues amongst vulnerable age groups on the rise because of this pollution as well. Would you say heart conditions are also affected by these rising pollution levels and also the severe weather conditions?
There is a possible link because COVID taught us the value of breathing good quality air that's free of infection. Yes, good quality air should not be just free of infection of viruses like COVID or influenza and bacteria like tuberculosis. We should also have what is called a low particulate matter count. PM2.5 is a technical term they use for it, which is basically means fine dust, the amount of fine dust in the air. Now, studies have shown, especially in the recent times, that people who are exposed to this, to very high levels of PM2.5, or let's just say air pollution, can have long-term diseases, and cardiovascular disease is no exception. Especially hypertension is well known to occur in people who are living more by the roadside, who are exposed to diesel fumes, to other fumes, to dust, and to more pollution in general. And one big factor that I must point out is the presence of smoking. See, tobacco smoke is the biggest risk factor for not only cardiac disease, but also cancer. So you don't have to be a smoker yourself, but if you hang around in the company of other smokers, or if a person smokes in your room, you could be at risk as well. That is why public smoking has been banned. So it's important to keep an eye out for clean air and take anti-pollution measures. It is primarily a disease of the lungs, which is called COPD, or chronic obstructive pulmonary disease. And if you talk to any pulmonologist in India, they'll say there's an increase in not only COPD, but also what is called interstitial lung disease, which is called ILD, which is a more, let's say, serious form of lung disease. And it may be linked with the increasing levels of atmospheric pollution. The heart attack in general, directly, there is no direct link between this air pollution and heart attack. I want to second Dr. Manocha's statement, that is, watch your lifestyle and know your numbers. Very basic things. Know your blood pressure, what's your height, what's your weight, and your abdominal circumference. More than BMI, which doctors had been measuring in the past, we are now looking more at the waistline, which is basically you take a tape around just around your middle, just above the belly button area. And if you're a male, you want to keep it below 90 centimeters, and for women, keep it under 80 centimeters. And if it is more than that, which happens to be the case in a substantial number of people under 50 in India, we've got to take measures to keep it down, because abdominal obesity is a risk factor, and we must definitely take steps to reduce it by diet, exercise, and as the doctor said, also I'll add the factor of sleep as well. You must make sure that you sleep well, manage your time well, make sure you get good physical activity and sleep as well.
Thank you so much, Dr. Rajeev Jayadevan there and Dr. Simi Manocha joining us on News 9 to bring us, in fact, eye-opening insights at this given point as to how we should be taking care of ourselves. Again, regular checkups is a must, an absolute must for all the young people, the young population out there, to keep a check of their health of their hearts. With that, ladies and gentlemen, we're now shifting our focus to another